It is the statement that echoed throughout the world. Kate Middleton now diagnosed with cancer and undergoing chemotherapy. Joining me now is OBGYN Dr. Greg Marchand. Dr. Marchand, I know we tried to reach out to you earlier. With regard to the actual cancer itself, she made a statement stating that it happens to be in the early stages. For those of us that are new to this, discovering this and hearing about this for the first time, walk us through the process with regard to early stages. What exactly is she referring to?
Well, thank you for having me. Yes, I also heard the very saddening news just a little while ago that the Princess of Wales has been diagnosed with a cancer. And she did mention in that video that I saw that she recently posted that she was in the early stages. Now, it's a little difficult to speculate since she's asked us to respect her privacy, so we don't know exactly what cancer she's talking about. But in very general terms, cancer is going to be staged usually into 4 stages. And the first stage is going to be when the cancer hasn't really moved anywhere. It hasn't invaded any other organ system, something in medicine we call metastasis, where the cancer travels, which unfortunately then means that more of advanced cancer and less of a chance for survival. So I would gauge by her saying that it's in the early stages and that the chemotherapy that she's getting is preventative, was her own words. I would guess that by those statements that she's making, she's talking about an early stage cancer, and probably when they identified the cancer at time of surgery, they saw that it was limited in how far it traveled, and most likely were able to remove all that they could see at time of surgery.
We also know that it is official that she spent some 13 days in the hospital following or during that surgery we should make mention of. Is that standard? Should that be an indication as to that something was really wrong?
No, and this has been a lot of discussion in the medical community. It is definitely not standard with medical care in developed countries to spend 2 weeks in a hospital following an elective surgery. And in this case, by elective, we mean a surgery that was planned, not an emergency surgery. That's certainly not going to be standard anywhere in the developed world. So it was very puzzling when she posted prior to the surgery that she had this planned abdominal procedure that was going to require 2 weeks of recovery. There really is no such procedure other than for cancer, which she stated it was not cancer. Other than for cancer and perhaps some transplant surgeries, there really isn't an abdominal procedure that's going to take 2 weeks of recovery unless there are some complications. So it was very puzzling that she said that before the surgery, and now we have the diagnosis that it was in fact for cancer. So that really does bring things together and make a lot more sense. But no, with the advances in surgical science, as a fellow of the American College of Surgeons, I can tell you that hospital stays following surgery have never been shorter, and most patients for most surgeries can leave very quickly.
Obviously, Kate Middleton, a royal, her experience quite different than both you and I. With that being said, the question is, how does that work with regard to her team of doctors walking through the process of informing her that she's actually been diagnosed with cancer? Can you walk us through that actual procedure with regard to what the doctors would say?
Well, it's a little difficult since I don't know exactly the type of cancer that we're talking, but most likely she went into the surgery knowing that they were going to be removing some sort of mass that had a potential of being cancer. And in a case like this, with them taking all the necessary precautions, in order to be sure with the diagnosis, they would have had a pathologist involved to review the slides. And I'm sure ahead of time she knew the chances. But one of the toughest things you can do as a physician is to have to give a patient a very sour diagnosis, a very unfortunate diagnosis like cancer. But in this case, it sounds like she had a lot of forethought ahead of time, knowing what procedure she was going to have, and the doctors probably had quite a lot of an opportunity to let her know about possible prognosis. And again, I only have the video that you've seen as well, so I don't know exactly what type of cancer or what exact stage, but in a case like this, most cancers that are caught early and can be treated with medical and surgical means have very good outcomes. So if I was telling a patient in this situation, I'd rely on the good side of the news, which is that we caught this early. I want to keep the patient's spirits up, and I want her to be ready to fight and ready to fight this cancer diagnosis, and let her know that the team is there to help her.
Doctor, you just made mention of the video that you saw, the video that I have seen, and the video now perhaps the majority of the world have seen. She looks somewhat frail, and that's just my statement. With that being said, she also made mention of undergoing premature chemotherapy. Is there a way that you can go about to tell that that's actually taking place? And with regard to her appearance, the frail aspect of it all, what does that speak to you?
Well, my specialty in medicine is going to be minimally invasive gynecologic surgery. So yes, unfortunately, she does have the appearance of someone that's gone through an abdominal surgery where it wasn't able to be done through minimally invasive means, or it was one that was just too difficult, or there was too much adhesive disease to be done through minimally invasive means. So she does have that appearance of someone who's probably had a large midline incision to have a surgery completed. I can't speculate whether or not she's had chemotherapy yet. That's tougher to see, and those symptoms of having had chemotherapy are a little bit easier to hide than the symptoms you have when you've undergone a major abdominal surgery. But yes, it does seem from her appearance, it does look like a typical patient who's received a major abdominal surgery and had to recover in the hospital with all the associated recovery elements, like getting the arms and legs working, those types of physical therapies that we do to get you back on your feet following surgery. And as someone who practices minimally invasive gynecologic surgery, that's kind of the main point of my specialty. We try to avoid those types of long recoveries and try to use more minimally invasive procedures whenever we can. But it does seem like this is one of those cases where a minimally invasive surgery just wasn't available or hasn't been developed to cure whatever this was.
Once again, if you're joining us, we're speaking with OBGYN Dr. Greg Marchand. Of course, the breaking news throughout the world, heard throughout the world, Kate Middleton now diagnosed with cancer, according to her, undergoing chemotherapy. A part of the video that she released, she made a statement, doctor, saying that she is now being treated by a team of doctors. Got about 2 minutes left, but with that being said, the team of doctors, is that standard practice typically for somebody like you or I? Would we just really be dealing with one doctor, or in this case, because she's a royal, she happens to be dealing with a team of doctors?
Well, it's a little bit difficult for me to speculate on what care is like in the United Kingdom. They have a little bit more socialized system than we have. But no, it would not be at all uncommon in the United States for a patient with a cancerous diagnosis to have a team of doctors taking care of him or her. The team approach is used in many large facilities all over the United States. In this case, it's a little tough because I don't know the exact cancer that's being treated, but I'm going to allude to the example of an ovarian cancer where you might have a gynecologic oncologist actually doing the surgery, and that team of doctors would have taken care of the surgical portion of it, and then you might have a different oncologist managing chemotherapy, and then even a third set of doctors with radiation oncology if radiation was going to be necessary to help treat the cancer. So certainly in the U.S., a team of doctors to treat cancer is a very common thing, and women, especially in the United States, should be aware that we have some of the most advanced treatments for cancer the world has ever seen. So cancer patients should not feel alone and should be aware that there are new discoveries every day on the treatment of cancer.
Once again, the one optimistic thing we could say here is that she caught it early, and that's a good thing. We've been joined by none other than OBGYN Dr. Greg Marchand right here on the Fox 5 Live Zone. Appreciate you taking time out to deliver us and join us with your specialty surrounding this issue, sir.
Thank you for having me.